You've probably heard about superbugs, real-life germs that have learned to fight back against our medicines. This is called antimicrobial resistance, or AMR. AMR happens when germs develop the ability to defeat the drugs designed to kill them, allowing infections to persist and spread. Overuse and misuse of antibiotics have accelerated this natural process, turning AMR into a global health crisis. Infections that were once easy to treat are now becoming harder, leading to longer hospital stays and fewer treatment options. The World Health Organization lists AMR among the top global health threats. Without effective antimicrobials, even routine surgeries and cancer treatments become risky. Our reliance on antibiotics is immense. They're the backbone of modern medicine. But as resistance grows, that safety net is unraveling. The consequences? More deaths, longer illnesses, and a massive economic burden on healthcare systems. AMR is a complex challenge involving science, human behavior, agriculture, and the environment. Bacteria can share resistance genes, making the problem spread rapidly across the globe. Understanding how resistance develops and spreads is the first step in fighting back. We need to know who is most vulnerable and how to protect them. Only with this knowledge can we build a strong defense against these microscopic foes. The fight against AMR is urgent, and it affects us all. Let's break down how gender plays a surprising role in this battle. For years, we treated antimicrobial resistance as a one-size-fits-all problem. But new research shows that gender matters. Men and women experience infections and drug resistance differently. Scientists are now analyzing data by gender, revealing that women are often prescribed more antibiotics, while men may face higher risks of severe outcomes from certain infections. These differences aren't just biological, they're shaped by behavior, healthcare access, and social roles. Ignoring gender can mean less effective treatments for everyone. By understanding these differences, doctors can tailor care, moving us closer to personalized medicine. It's not about one gender being weaker or stronger, but about recognizing real differences that impact health. Hormones, immune responses, and even the bacteria living in and on us can vary by gender. Social roles and healthcare habits also play a part. Exploring these patterns is crucial to getting ahead of the AMR crisis. Let's look at why male and female bodies respond differently. Male and female bodies are built differently, and this shapes how we fight infections. Women's immune systems are often more reactive, helping clear infections faster, but also increasing the risk of autoimmune diseases. Hormones matter too. Estrogen can boost immune responses, while testosterone may suppress them, making men more vulnerable to some infections. The microbiome, the community of bacteria in our bodies, also differs by gender, affecting how we process drugs and which bacteria thrive. Anatomy plays a role. Women are more prone to urinary tract infections, leading to more frequent antibiotic use. These biological factors combine to create different risks and outcomes for men and women. Understanding these differences helps us target treatments more effectively. But biology is only part of the story. Lifestyle and behavior matter too. How we live and interact with healthcare also shapes resistance patterns. Women tend to visit doctors more often, leading to more antibiotic prescriptions, often for real health needs like UTIs or reproductive care. Each antibiotic use increases the chance of resistance developing. Men, on the other hand, are more likely to stop antibiotics early, fueling resistance. Social roles matter. Women are often caregivers and healthcare workers, increasing their exposure to infections and antibiotics. In some regions, women may have less access to qualified healthcare, leading to misuse of antibiotics. Health literacy and education also influence how antibiotics are used. These lifestyle and social factors create gender-specific patterns of resistance. Addressing them is key to effective solutions. So what does the research actually show? Let's look at the evidence. Studies confirm that gender shapes resistance patterns. In Europe, women, especially younger and middle-aged, show higher resistance rates to antibiotics for common bacteria like E. coli, often linked to UTIs. Men are more likely to suffer severe, sometimes fatal MRSA infections, possibly due to immune differences and higher risk activities. In India, men are more likely to have multi-drug-resistant tuberculosis, influenced by factors like treatment adherence and lifestyle. These patterns vary by disease and culture, but the message is clear: gender matters. Data-driven insights help identify who's at risk and guide public health strategies. Knowing these differences allows for smarter, targeted interventions. The evidence is growing, and it's changing how we fight superbugs. So how do we use this knowledge in practice? The goal is personalized medicine, using gender data to improve care. For women with UTIs, doctors might order targeted tests before prescribing antibiotics, ensuring the right drug is used from the start. For men with severe infections like MRSA, clinicians may act faster and monitor more closely, knowing the risks. Public health campaigns can be tailored. Messages about finishing antibiotics might target men, while campaigns about unnecessary prescriptions could focus on women and caregivers. This approach refines care for each person and helps slow resistance. By understanding gender-specific risks and behaviors, we can design smarter prevention and treatment strategies. It's about using data to protect everyone, but to do this well, we need more research. Here's why gender-focused research is crucial. Recognizing gender's role in AMR is a breakthrough, but we're just beginning. Medical research has often overlooked gender differences, sometimes putting women at a disadvantage. Future studies must include both sexes and analyze data for gender-specific effects. We need to understand how hormones, microbiomes, and behaviors shape resistance. Healthcare professionals and the public must be educated about these findings. Tailored public health campaigns can change behaviors and save lives. Addressing AMR requires a global, multifaceted effort, and gender is a vital part of the solution. By embracing personalized medicine, we can improve outcomes and strengthen our defense against superbugs. Paying attention to our differences might be the smartest way to win this fight.